Dr. Pran Yoganathan, I'm so excited to have you here finally. I've been trying to get you on for ages, and you have had some, I think your house flooded last time. So we finally get you on. I'm honored to have you here from across the world.
Thanks for having me on, Tina. And yeah, the house did flood, and I must admit the basement is still flooded. We're working on unflooding it, so to speak. But I really appreciate you having me on your show.
Well, I am so excited. Would you quickly introduce yourself to the audience, let them know who you are and what you're about? Because I found you on social media and I just mind blown. You're probably my favorite account, hands down. And you're a wealth of knowledge. So not only what you do, but like, how did you acquire this wealth of knowledge?
I appreciate that, and that means a lot. I'm a gastroenterologist and a hepatologist by trade. It's a mouthful, but fundamentally what that means is that we specialize in diseases of the digestive tract, and hepatology is a sort of a subspecialty within gastroenterology, which is the study of the liver or diseases of the liver. So that's a subspecialty of internal medicine. We tend to do a lot of procedures in terms of endoscopies and colonoscopies and procedures called ERCP. The field has become a lot more advanced in that from that perspective. In terms of how we are kind of ending up linking and connecting is my interest in nutrition and lifestyle in terms of how it intersects with chronic illness and human disease. And I think I've always been interested in that. Medical school was an interesting place because we were taught that so much of modern illness was lifestyle related, but we weren't really taught about lifestyle changes as doctors, and I've always found that a little bit of a paradox. We're very good with treating from a therapeutic perspective in terms of medications and surgeries and so forth, but very little attention paid to lifestyle. So in the last few years, as I've become a lot more comfortable in my skin as a doctor, I think I've gravitated to that mode of practicing, and hence why we're sitting here talking today.
Yeah, so I have to tell you the truth. It's actually your post about animal behaviorism and more of that zoology slant that you started throwing into your Instagram that caught me, because my background is, well, pretty deep in zoology and animal behaviorism. That's what I wanted to do with my life. And I pivoted. I wanted to be a doctor my whole life, but then of course, my passion was in animals. And I think that there's a lot of overlap and a lot we can learn from the way that they behave. And I feel strongly that humans' separation, and I don't know what it is, and it's interesting because we're going to talk a lot about eating protein, but our separation from nature and from animals in particular, I think is going to be our downfall as a species. I think we're symbiotically related and intimately tied into animals. And we talk a lot about the earth and we talk a lot about resources, but very often people don't really talk about animals. And you seem to tie that all together really beautifully, along with nutrition. I think we're very like-minded in that. And the deadlifting part, you got me. That was it.
we are connected in that regard. Like, it was very interesting, Tina, because I spent a lot of my life in Africa, basically, in villages. My father was a village dentist in a place called Zimbabwe, and we lived in a small town called Bindura, town/village, very small. And, we were very closely connected with nature, and, you'd often see baboons and things like that come out and sit in their groups. And I just, even as a kid, it just really struck me how much like us they looked and behaved, and a lot of the mannerisms and so forth. And I was always a bit of a weird kid. I remember sort of wandering around with encyclopedias and stuff, and I loved reading that stuff. So at a very early age, I was exposed to science, zoology, evolution, the theory of evolution, the fact of evolution. And I think that's always stuck with me, even as I went through my medical degree. And as I've become more mature, as I said, in my practice, I'm just more comfortable linking all that up. And it's interesting, so many medical doctors out there that just have a really poor understanding of evolution, and potentially whether human disease or modern human disease is fundamentally us living outside of what we're evolved to do as a species of animal. We also tend to gravitate, I think, as human beings, towards a very egocentric model of the world. We're told that when we're children, we've got this egocentric world, and then we grow out of it and we become less egocentric. But the reality is, I don't think we ever grow out of it. I think we truly believe that as a species, maybe not as individuals, but as a species, that the world the universe kind of revolves around us, but that's not the case. I also witnessed in Africa and Asia, where I'd spent long parts of my life, that life was also very, very cheap. You saw people at a very young age losing their lives because of drinking contaminated water and things like that. When we were in Africa in the 90s, HIV and AIDS was becoming a major problem. I just watched people die left, right, and center. And I thought to myself, like, really, there is so much about the world that's cruel and beautiful at the same time, but certainly taking an egocentric perspective on the universe is a really, really big problem, which I think the majority of the world suffers from. We are fundamentally a species of animal, and we are always going to be intimately tied to nature, but so many of us are disconnected from it, and that fundamentally is the issue.
I agree completely. I think that's why we're in this pickle right now, currently, with the pandemic and the groupthink. It goes very much back to our animal behaviorism instincts and how we are I always say we're just fancy mammals with opposable thumbs.
Yep.
And people, they want to put things in boxes. Nice humans want to put things in tidy little boxes that they think they have control over. And it's just simply not true, right?
100%. That's right. We've got no control. We're sort of hurtling through this universe with very little control over our lives and the course of time, for that matter,
Yeah, that brings me to my next question. It was very clear to me early on from studies coming out of China that diabetics were getting hit hard, and that metabolic health was going to be crucial to get through this. I could see that easily from the beginning. I knew that, though. Docs like you and I knew that a decade ago, right? Like, this isn't anything, or further. Like, my mentor was talking, gosh, in the early 90s, there was no name for the diet. There was no paleo diet or carnivore diet back then. It was just, he avoided grains and carbohydrates. He ate fruit and meat and other whole foods. He always encouraged me to strength train, particularly the big muscles, and pretty much forego cardio. This was back in the 90s when everybody was a cardio bunny. And he was like, nah, cardio, just lift weights, you'll be fine. Get adequate sun, sleep. I mean, he was a naturopathic physician, so it was very much, standard. Why not help everybody get more metabolically sound so that they can deal with the infectious process?
Yeah, absolutely. I'll tell you why, Tina. Come and take a walk with me through a hospital here in Australia, for example, and I'll point out the physicians to you, and you will realize very quickly that the system and the doctors that are supposed to be kind of perpetuating health, these people are fundamentally broken and metabolically unhealthy themselves. And so if you don't know what health is, or in inverted commas, what metabolic health is, that can be very strictly defined. There's pillars to metabolic health. How can you kind of teach your patients how to achieve it? So very quickly, I think we just gravitated towards a drug-centric approach, because all of the world, vast majority of the world, is metabolically unhealthy. We're not just talking America. America gets singled out, but America's greatest export was their diet, and they've exported it along with all the problems that standard Western diet brings. And so vast majority of the East is also metabolically healthy. And here in Australia, we've got 60 to 70% of doctors that are overweight or obese. So it's like, well, how are these people going to emphasize metabolic health when they themselves can't define it? You can pull up 90% of doctors and ask them to define what metabolic health is. They wouldn't be able to do it. That's
a very good point. That's a very good point. Let's talk about your work a little bit, because I had no idea that you were a GI doc. This is very exciting. I swear, I found your account and I was like, this is so freaking good. Every single day there's a different post. Sometimes where you're talking a little bit of flavor of stoicism. Sometimes you're talking philosophy. Sometimes you're talking, evolution, nutrition, strength training. And to me, all that works together in my head too. And I have honestly never met somebody who talks about that stuff so readily. And it all, I can tell that's a bit about how your brain works. Now to find out you're a GI and liver doc. So tell the audience what fatty liver is and how that relates to what we're talking about here with metabolic health.
So fatty liver disease, it was a relatively rare phenomenon 30 to 40 years ago, okay, but became so commonplace now that radiologists, these guys that do the ultrasound and CTs, when they see fatty liver, they no longer report it because, everyone's got it. Okay. But fatty liver disease, or non-alcoholic fatty liver disease was the label for it, is fundamentally a misnomer. What it is, the new definition is metabolic syndrome associated fatty liver disease. This is literally a definition change by some of the highest bodies in liver disease, okay? Metabolic associated liver disease. In fact, the guy who coined it is Professor Jacob George here in Sydney, Australia, Westmead Hospital. We trained under him as junior doctors, very brilliant man. So the liver is exposed to the gut. I mean, it fundamentally drains energy from the gut. And if your diet's energy rich, the liver is a storage spot for the fat. So you cannot separate fatty liver disease from metabolic syndrome because they're both one and the same. We know that metabolic syndrome involves visceral adiposity. This is where you pack visceral fat or fat in the inside of your abdomen around your organ systems and so forth. And that fatty liver disease is fundamentally an offshoot of that. It's these organs get packed out with fat. And I don't think we can separate it out from metabolic syndrome, because you look at the muscle of someone with metabolic syndrome, it's infiltrated with triglyceride. It's infiltrated with fat. It's the same with the liver and any other organ system, heart, lungs. It's like it permeates everywhere. And that's the problem with the modern medical system, or the allopathic system. It wants to classify everything into an organ system. You've got a neurologist that deals with brain, you've got a liver doctor that deals with the liver, you've got a diabetes doctor that deals with diabetes, but really the entire system works in concert to provide a healthy or a diseased state. So fatty liver disease is exactly that. It's metabolic syndrome in evolution, fundamentally.
And when we see fatty liver early on, at least what I have seen clinically, it's often the harbinger. It may show up a little bit earlier. I'll start to see subtle elevations on liver enzymes. I would always order a liver ultrasound for patients. And if I suspected it and they didn't understand why they needed it, often they'd come in with their lab results from other physicians and say, yeah, my doctor said I have a touch of fatty liver, but it's nothing to worry about, which just blew my mind. And I would always think that's probably because your doctor has fatty liver too. It's been normalized. And I've watched it become normalized throughout my career, which started in, 2008 is when I first became licensed. And I just watched the advent of fatty liver just become the norm, to the point where I was just telling Mike Mutzel this earlier. I ran thousands and thousands of labs on people looking at their overall metabolic health. And I rarely came across somebody who was metabolically sound. It's not the norm. Absolutely. Do you find that?
Absolutely. One of the most important laboratory parameters to order, including liver function tests, fatty liver disease, is in fact serum triglyceride. Do a serum fasting triglyceride. Pounds to peanuts, this is always elevated in people. And you go, well, what's a normal triglyceride? They say the cutoff's 2, right? But when you get yourself pretty healthy or optimal, you'll find that serum triglyceride generally drops to about, 0.5, 0.6, under 1, I think is ideal. I don't know what the lab values are. It might be a little bit different over in the States, but hypertriglyceridemia is always associated with fatty liver disease in my experience. And hypertriglyceridemia to me is fundamentally a diet that is energy excess, or someone who's losing a lot of muscle. Essentially, you've got to know where to put the triglyceride, to burn and store the triglycerides. So, if you wanted to apply that whole calorie in, calorie out model, which I don't do, hypertriglyceridemia generally is caloric excess in the setting of poor calories out.
Right. It's 150 is my cutoff functionally. That's where I start to ring the bell, at least in our parameters. And the rule that I always have is when total cholesterol and triglycerides start to match, we have a problem. That's that's when I start ringing the bell for the patient. And I can't tell you how many physicians have come to see me, dentists, other health practitioners. And I often found it in your middle-aged doctor who liked to drink. Honestly, that was usually they like their wine. It was subtle. It was never heavy, but stressful job. And they would like their wine on the weekends. They were generally runners or cyclists that did not lift weights. And they would come in, and that would be one of the first things I would see is I maybe would run sort of just a thin panel on them. I wasn't diving into the serum insulin yet. I was just trying to, you kind of got to ease people into this sometimes without hitting them with by the way, you have pre-diabetes. And that was always my alarm was, hey, your trigs are starting to match your total cholesterol. This is a problem. You're getting fatty liver. And they would argue with me incessantly about it and get mad. And I'm like, dude, don't shoot the messenger. I didn't make up the rules. I'm sorry you didn't learn this or pay attention to it in school, but that's indeed what's happening.
100%. And triglycerides are often ignored. You know, the medical world is obsessed with the LDL cholesterol, which, I mean, there's nuances to LDL, and I'm not saying it's not important. It's very important, especially when you break it down into its subfractions. But the things that are clearly defined by, or metabolic syndrome is clearly defined by, is insulin resistance, visceral adiposity, right? You got hypertension or vascular dysfunction. And the other two remaining tenets of metabolic health are HDL and LDL and triglyceride. And you've got doctors completely ignoring triglycerides, like, oh, it's not an important parameter. It's one of the most important parameters. And I think the HDL triglyceride ratio is critical in determining your propensity to atherogenic deposition. So I think, like, the definitions are clear in medical school. We're taught it, but the emphasis is on LDL because LDL can be medicated, right? And LDL can be lowered with statin therapy. And so this is the problem. We've got no way to actually safely lower triglyceride. The trials have been really poor from a pharmaceutical perspective. Well, I'll tell you why, because the way to lower triglyceride is to build up muscle and stop eating the excess energy. And ethanol, we know, directly converts to triglyceride. And same thing with fructose in excess. If you're eating a lot of commercially produced fructose, and we know a lot of the chocolates and sugar sweetened beverages and so forth are very, very rich in commercial fructose, which is different, of course, to the fructose found in fruits, because that's lumped in a natural matrix. You've got a problem, you know, and you know, historically, the way alcohol worked is, you know, animals or early humans would have picked up rotting fruit underneath trees, eaten it. They would have gotten a bit of kick out of it through the alcohol, stored the alcohol as the triglyceride, and then utilized that triglyceride at some point later on through the amount of fasting and exercise that they would have done. So it served an evolutionary purpose. But like everything, you know, humans gained control of it. That was a process of fermentation that we had no control over. We were early humans, you know, but we later learned to control fermentation. And so we've got commercially available alcohol now, and we've got a big drinking culture here in Australia. And I think it's similar in the States as well, that if you're out with people, you've got to drink, and you're not a man if you don't drink beer here in Australia. It's like, you know, you can't go in and order a champagne as a guy, you get laughed at, you know, so it's a big, big drinking culture that we've got here in Australia. And I think that's problematic.
For sure. Yeah. The quickest way I've seen to get out of that fatty liver scenario was by telling patients to decrease refined carbohydrates, quit drinking alcohol, and start lifting weights. And it was like that. I mean, it would turn it around every time. And you know, as well as I do, that's not always easy to expect them to be compliant with. We can try, but it's such a simple solution. And it's always made so much sense to me. And whenever I saw fatty liver, I would say, you know, just start lifting weights. It'll burn up the fat in your liver first. It'll be gone. Give me 3 months of that. We're going to see dramatic changes on your labs, especially if you decrease or discontinue the alcohol. And the pushback was, it couldn't be that simple. They wanted a pill, you know, it had to be something. And it was a circular thing. I would go around. Women would be more responsive to it than men. And maybe that's part of the, maybe just maybe a woman telling a man to strength train. I don't know. What's your luck with telling patients to strength train?
Yeah, some will take it up. I mean, Tina, what I've realized is we're a lazy species of primate, right? And in fact, all primates are. Given adequate energy, they won't travel long distances. We're kind of by design or by evolution made so that we can conserve energy. So long periods of rest and sitting around the fire or whatever it is, just kind of relaxing. So most of us still carry vestiges of that hunter-gatherer model where, yes, we had to work to gain our energy or food, but if given the opportunity, we would be lazy. We're a lazy species. And I think there are some amongst us in the population that are just compelled to move, right? And I'm one of them. Luckily, I'm one of them. I've been strength training since I was 15 or 16 years of age. I've had periods of breaks and so forth, when the kids came and that. But to tell someone who's 60 years of age to start strength training when they've never done it before in their life, it must be a shock to them, right? The thought of walking into a gym with all these fit people around you, who clearly know what they're doing, and you're there kind of out of your depth or out of your element. And I see these people at the gym all the time, and I actually genuinely, my heart goes out to them, because without a good coach in that sort of situation, you'd struggle. You really would struggle to pick it up. So I think I've always felt a good coach is critical. But again, there's cost barriers and so forth that people might have in accessing these sort of things. So there's many factors that go into it. But I think people are genuinely intimidated to start weight training. It sounds daunting for people that have never done it before. I guess for people that have always moved, always done it, well, it's just muscle memory. You pick it up and you do it. It's just your routine.
I didn't start till I was 40, and it was daunting. And I did have a coach, and I do realize I had the privilege of being able to afford a coach. It's funny though, I worked my ass off. I really was not in a good place financially when I hired my coach. I was not in the best place, and I was a single mom, and I was just building out my practice. And I remember a boyfriend saying, because I was going through a tough month or two because we had an ice storm and patients weren't able to show up and things were getting a little thin. And he said, well, just cancel your coach. And I looked at him like, are you crazy? And I said, I go to work and bust my ass so that I can afford my coach. I don't have nails. I don't have fancy purses. I had a beater of a car that kept breaking down at the time, but I was damned if I was going to give up my coach, because that to me is health insurance. Like that was everything to get me out of my chronic sickness and my chronic autoimmune kind of downward spiral. So I really value the muscle on my body, and it was costly to build for me, but I understand what you're saying too, though. I think that is access in different capacities. There's group training, there's online programs. I'm with you though, as somebody who treated a lot of orthopedic conditions, predominantly musculoskeletal medicine. I saw a lot of injuries happen from people who didn't know what they were doing. So I'm a big fan. We have silver sneakers here in the US where elderly folks get that. With most health insurance premiums will give them free access to a silver sneakers club at the gym, and they can go around, and it's not a lot of free weights. I think maybe it's evolving. It's usually the machines, but it's fun to watch. And there's a group of old guys that used to go to my gym. 3 of them, I'd see the one guy would come in a walker, but he would still lift. And it was so inspiring to see. So it takes all types, but if I could get everybody listening to embark on one thing, I would encourage them to find a way to learn how to strength train safely, because I think you can't outlift your diet, but man, I have seen I'll tell you this, when I was doing regenerative injection therapies, it's contingent on somebody's ability to heal. So however healthy and vital they are is how they're going to respond. If they're malnourished, it's going to be less. If they're under muscled, it's going to be less. But I was always looking for one determining factor. Like, what's the one across the board, the one thing that I could count on telling a patient, you're going to do well. And it was those who were well muscled, those who had good muscle mass. Even if they were guzzling Mountain Dew, they would always heal really beautifully after I treated them, versus say someone who was completely, deconditioned and eating perfectly. The folks with muscles, it was beautiful like that. So that was what got me. That's what really got me into strength training. I was in practice for a few years, and I was like, all these people with muscle are doing really well with my therapies and my treatments. I should probably start strength training. That should probably be top of my list.
Absolutely. I think there are myokines and muscles that control cytokines, and muscles like I think it was Gabrielle Leon, one of the doctors up there in America, and she said it's like a suit of armor, and I agree with that. So I think that's very eloquently put. It's fundamentally your suit of armor that's protecting you through this journey of life, where where you're met with infection, you're met with environmental toxins, you're met with this terrible food environment we've got. So strength training is critical. And I've seen people on vegan diets thrive even without sort of testosterone supplementation or whatnot. I've seen them naturally do it. I mean, of course, they use powders and supplements and so forth, but it just shows you resistance training can overcome even a very, very restrictive diet like a plant-based diet. Some can thrive on it, and I acknowledge that. So yeah, resistance training is key, and I think it should be non-negotiable. But as I said, like getting people to do it in my clinical experience it's been very difficult. People don't take it seriously. I mean, their concept or their definition of exercise is a 45-minute walk, gentle stroll, which we know probably does absolutely, bugger all if you're already metabolically deconditioned.
Right. And that's the hard part, because I do think that the daily walk is a critical piece of the puzzle, especially post meal. It's important to, if you've got metabolic issues, it's really important to go for a walk after you eat, especially if you eat a carbohydrate rich meal. Although I'm a big fan of earning your carbs, I eat carbs heavier on the days that I lift. And I don't have the perfect body, and I'm not going for I used to have the perfect body, and it was really hard to come by. It was really challenging to keep that little belly pooch off and all of that. And I'm 48. I just want to feel good. I want to be pain-free. I want to sleep well. I want to have good energy. I want to have a good libido. I want to be able to do all the things that I want to do when I want to do them and not be hung up, because I have struggled with chronic pain and injuries. And I've been at that dark, low place where I'm like, am I going to be able to walk again, because my hip was so messed up. So I get it, but I think that people want to substitute, and I'm like, no, great. If you want to do cardio, cool. If you want to do yoga, cool. If you want to I love Pilates. I think it's really got a lot of utility, but I mean, man, without my reformer, I think my spine would be a mess. It's the one tool I have to get myself out of chronic pain, but those are all sort of like frosting on the cupcake. The strength training is the core. You have to earn the running. You have to earn the other things, in my opinion. And the walking is just like breathing air and drinking water. It's an expectation of being a human being. That's kind of how I share it with my patients.
Absolutely. Yeah, absolutely. I think strength training, what I tend to tell my patients is strength train at least 3 to 4 times a week, hit the big muscle groups like your posterior chain and quads and back and pecs, and then try and walk 4 to 5 times a week, at least 10,000 steps, 8 to 10,000 steps within best of your capacity, and just do a high protein diet. You give them all the tools, you give them all of that, but to get people to actually go through with it's challenging. So there's a lot of barriers to it, and I think for a lot of people, it's mental.
For sure. I wonder what the motivating factor is for most people. In my practice, I found that pain and vanity were 2 very good motivating factors for people. But I've seen more and more as I've gotten older, and especially through this pandemic, that vanity seems to no longer be a very motivating factor for people. It was early on in my practice, and that wasn't that long ago, but it seems to kind of gone by the wayside with this health at every size movement, where it's like, oh, you can be, heavy set and still be healthy is the prevailing theme. What do you think about that? Because I love the idea of body positivity, love yourself at every size, but we also have to get real and realize, I think a lot of young people have homeostasis working in their favor, so they can carry excess pounds and they can carry that subcutaneous fat just fine. But eventually that starts to shift towards more of the visceral fat picture. It becomes more pro-inflammatory. And as they hit their 40s, that's when we start to see their labs derail. So how do you approach that?
Yeah, I agree. I think it's kind of downhill for most people from the mid-30s onwards. I think there's muscle loss, and I think metabolic syndrome starts becoming more pronounced. With regards to the body positivity movement, it's more of the sort of ultra left-wing wokeism that we're seeing now in the world. There's many examples of it, and I put veganism and sort of this whole climate change and some of the other stuff, which we won't get into. It's probably too controversial, but I put in this whole body positivity thing into that category as well. It's a problem because, we know that being overweight and being obese, it is, as you've said, it is pro-atherogenic. You're at increased risk of heart disease, strokes, death from infection, diabetes, gout. I mean, the list goes on, blood pressure, cholesterol. The list goes on. It's like, what more do people need? So how do we promote something that is, we know, detrimental to health, as well, just love yourself at that size. I agree, to be positive about your body is important, but as doctors, as clinicians, we've also got the right to tell people when potentially they're harming themselves. We've got to do that with empathy. We've got to be sensitive to all of that, but at the same time remain factual. And I've always been like that with my patients, and so most of them I think appreciate it. But there are a lot of instances where it's gone wrong. I've had to deal with complaint letters and so forth. And sometimes you reflect on it and think, is this really worth it? The stress and so forth. Just be a normal gastroenterologist and see a patient, label their gut symptoms as irritable bowel, and just do a colonoscopy, get paid for it, and move on without the stress. But I wouldn't feel comfortable practicing medicine in that way. I think I would struggle to sleep at night with that type of practice. I'd probably earn more and have less headache approaching gastroenterology in that way. But I just wouldn't, philosophically and fundamentally, I think I would let myself down and struggle to keep invigorated about coming to work every day. So yeah, I mean, I'm all for body positivity, but I'm also going to point out, if your lab parameters and potentially measurements, blood pressure, waist circumference, so forth, point out that potentially your metabolic health is declining, I think facts are important.
Facts are important. I tried to share the diagnostic criteria for metabolic syndrome, which is an international standard.
Yeah.
Regardless of which, organization you're looking at, who defined it, it's pretty much across the board the same. And I can't tell you the amount of people who called me dangerous. They literally dropped in and said, "You're dangerous. How dare you?" I mean, I was attacked for it. And I was so confused. I'm like, this is not an opinion piece. This is a diagnostic criteria. As a physician, this is what we're trained to understand. How on earth could this be construed as a subjective emotion? It was very odd to see how people reacted. I did a series of pieces about waist circumference. I think that was about the time I discovered your account. I was talking a lot about waist circumference, and waist circumference alone is a pretty damn good diagnostic standard for, I'll take it as a vital sign. Honestly, I'll look at somebody and see how well muscled they are, and I'll run their waist circumference. And if they've got high blood pressure to go along with it, I'm pretty sure they have metabolic syndrome, and I'll run labs to concur. But they were so mad at me. People were so mad about it. And again, calling me dangerous. And every time I bring up metabolic health, I get accused of being dangerous. And this brings me back to something you just said, the headaches you're enduring. People get so angry when they are sort of shoved around from doctor to doctor, or sort of blown off, or given some sort of like mediocre care. But what they don't understand is that when doctors like yourself, I chose to become a naturopathic physician strictly so that I could say those things, because we are not beholden to the standard of care. We are beholden to best practices, but we don't have to kiss the American Medical Association's ass. So that is specifically why I became an ND. But doctors like yourself really do come under a lot of scrutiny, investigations, complaint letters, all kinds of issues, simply for speaking truth and maybe sharing objective data that isn't the standard. And that's often why doctors will just sort of see you and brush you out of their clinic, because it's too much sometimes. It's too much of a headache. It's too much effort. It's more than they want to deal with, and definitely more than they're getting paid. So that's what I want to share with the audience listening is it takes a gutsy doctor with a thick skin and a real heart for it to stand up and say no. And they expect us to behave that way. So it's like across the board, no matter what the profession, there's only a few brave ones, period.
Yeah.
Right?
Yeah, absolutely. And I think people want to be led, and part of having a social media presence and doing podcasts and kind of being out there is that you slowly over time start eventually getting patients that gravitate to you because of your ethos. And that's what's slowly occurring, is that I'm seeing people that are already motivated, that are kind of understanding that the current system's broken, and they come from all over Sydney and Australia and from all sorts of suburbs. They travel long distances. And that's the kind of practice that I'm starting to attract now. And of course, there's been a lot of, because we get referrals from general practice or primary care. There's been a lot of primary care doctors that have said, look, we're not going to send patients to Pran anymore because we know how he approaches it. And I lost a lot of work that way and probably lost a lot of income. But as I said to you before, Tina, I'm just happier. I'm just happier when I can practice this way. And I'd rather kind of sacrifice some income for that happiness. And I think we're starting to get really good outcomes from the patients that can follow. And as I said, now we're starting to draw in people that are already, they're already convinced that they need to make the first step, as opposed to me breaking my back during a consultation to prove to them that, hey, you need to make some changes. So it's getting better in that regard, which I'm pleased about.
I love it. And that is the beauty of social media. It's really a tool to be able to speak your truth and invite in and curate your practice or your business with the right kind of people who are of the same vibration. Okay, I want to ask you a question though. You mentioned fatty infiltrate of the muscle, and will you just quickly take us through what the general sequelae and what people can expect when they get diagnosed with fatty liver? What does it specifically do to the liver? And then what does it do to the muscle? And why is that a problem?
So when you diagnose with fatty liver, often it's based on liver biochemistry or liver function testing, which is a blood test, of course, showing elevated transaminases, in particular the ALT and the AST. Often the ALT is the best marker. So then an ultrasound's done and the ultrasonographer picks up fatty liver, and the GP or the doctor will turn around and say, you've got fatty liver, you've got to eat less, move more, right? That rhetoric. And so the patient goes away confused, tries an 800 to 1200 calorie diet, which is basically carbohydrate based. They get very little satiety out of it, drop muscle because they're in a calorically restricted state with poor protein intake often. And people have got it into their heads that it's beef doing it or red meat doing it, and we're going to have to limit all that. And so what do they gravitate towards? Refined carbohydrate, more fruit, grains, which we know are very low in protein, just low protein food. So they go away, drop 3 or 4 kilos, and they're miserable as they're doing it. And a lot of that 3 or 4 kilos is muscle. They've lost muscle mass, right? And so, and they come back to the doctor, and the doctor goes, well, you've seen some improvements, but the fatty liver is still there. And they go, bugger this. And they just go back to their way of eating. Now they go back to their baseline calories with reduced muscle now. So they pack on even more fat. So the vicious cycle kind of continues. And that fundamentally is the cycle that we see, okay? Fatty liver over time is a disaster because fat is inflammatory. Fat is a potent producer of something called interleukin-6, which drives something called CRP, C-reactive protein. You can measure this in the serum of people. You'll see that people that carry a lot of weight tend to have elevated levels of CRP because they have higher levels of interleukin-6. Now, over time, having fat in your liver is like drinking a couple of bottles of wine. And some people are more genetically predisposed to getting inflammation in response to the fat. Over time, it can lead to cirrhosis. In fact, they predict in the next 20 years, it will overtake viral hepatitis and alcoholic hepatitis as the #1 cause of end-stage liver disease. And we're going to see that in our lifetimes, Tina. We've got kids now that are 5, 6 years old with fatty liver. That's by the time these kids are 25, 26 years old, that's a 20-year exposure to or 25-year exposure to fat in the liver and inflammation. We're going to start seeing cirrhotics at 20s and 30s, requiring liver transplantation. And instead of fixing the environment that's doing it, all that's talked about now, and you go to these liver meetings and you sit around with other hepatologists or gastroenterologists, who most of them are morbidly obese or overweight themselves, which is a real paradox. And all they talk about is the new exciting drug that's coming on the market for fatty liver disease. Okay, and it doesn't address the fundamental problem. And I often point it out to them. I say, well, shouldn't we do this? And I sort of get stared at blankly. And often their response will be, oh, patients can't follow a diet. It's like they've written people off immediately. And I think this speaks to the apathy within the medical system, the allopathic system. It again goes back to the fact that these people are so overworked, so hamstrung by massive mortgages and student loans and stuff they've got to pay off. They've got no time to do health themselves. So how do you pass on health if you yourself don't have it? There's a real culture shift required within the medical system. I've digressed a little bit on your fatty liver question, but that's the general general cycle that we see. People don't get better from fatty liver disease. Very few will do it. Yet it is as simple as dropping 6 kilograms of fat, and the fatty liver disease will resolve. Sometimes within weeks.
Yeah, with weeks, lift weights and drop some fat. It's
100%. Yeah,
cut the
that's
carbs
exactly right.
and cut the booze and lift some weights and go for walks after your meals. And it's like magic. It works.
It does. It's that simple. Yeah, we've had really good results with some of our patients, and it's just rapid and dramatic, and yet there's cognitive dissonance. The patient will go back to the general practitioner and say, look at what I've achieved. And the general practitioner will say, brilliant, what are you doing? I'm eating more beef and lifting weights. Oh, you can't do that. So there's a significant cognitive dissonance that we've got in the medical system. And I'm not sure how we're going to change that. The culture needs to shift internally from in the medical schools themselves.
So these folks are looking at cirrhosis, which basically means severe scarring up and death of the liver, and liver transplants, or they're going to die. That's the sequelae that's what I try to explain to patients, and they just can't believe it. They're like, how could my doctor just blow this off? And now you're telling me this, right? And yeah. I'm not trying to scare them. I'm just like, this is what it looks like if you don't take me seriously. And that's where we are in medicine. That's the mind-boggling piece, where something that's been completely normalized, like you said, they don't even report it. They just scan right over it unless I have them go look for it. And the end stage of that is what we just shared, which is horrific. And so it's a disaster, people. If you have fatty liver, which I would say 88% of Americans probably have some start to it or streaking in their liver, this is the real deal. This is why I beat this metabolic drum all the time. And people are probably so sick of me saying it. And then they're like, what's the solution? What can we do? And I'm like, lift weights and eat meat, lift weights and eat meat. My mom was joking the other day, because I think for 20 years, that's what I've been saying to her. Every time she comes to me, my friend has this, or so-and-so is dealing with this, or so-and-so. And I'm like, Mom, root cause, metabolic syndrome, lift weights, eat more meat. That's always the solution. And I think everyone's getting tired of hearing it, but it really is that simple.
Absolutely, Tina. I couldn't agree with you more. It is definitely, like, what we're seeing is not particularly rocket science. It's evolutionarily consistent to what our bodies are designed to do and eat, and the way we're supposed to nourish ourselves. But there's so many barriers to it. Like here in Australia, we've got our cancer council telling people that beef increases your risk of colorectal cancer. So you've got people knocking off bowls of pasta at night but avoiding the steak, because they're worried it's going to cause bowel cancer. Meanwhile, their diabetes is rampant. And you see them here in rooms, and you say, well, look, your diabetes is pretty crap. Why don't you start eating more protein? Oh, well, I'm avoiding that because I don't want to develop bowel cancer, notwithstanding the fact that metabolic syndrome is probably the biggest risk factor for colorectal cancer. So we've got public health messaging that is against what doctors like you and me are trying to say. So it's like we're swimming upstream against the tide, or going down some sort of white waters without an aura, because it really does. You after a while, you just realize there's so many barriers to care. And so I'm hopeful that with the advent of social media, the message kind of gets out, people start paying a bit more attention, and a healthy mistrust of authority, I think, is what's needed. But most people want authority. They want to be led, as I said before, and these are all challenges.
Yeah. Okay, quickly, and then I'll let you go because I know you're a busy man. So next, let's move into the fatty infiltrate of the muscle. What does that look like, and what is the problem with that?
It's a problem, Tina. So I think the best thing to do is take a animal like we hunt deer here in Australia. Take an animal like a deer that's been out foraging in its natural environment. And when you butcher the animal, there's just very little fat infiltration. It's an active animal, no exposure to grains. And then take a cow that is heavily grain fed, right? And have a look at the muscle and how it's infiltrated with all the fat, which we as humans desire. We love fat, right? Because it's palatable. But is that a healthy animal? I think probably not. And that's what the human muscle looks like. You can see it on MRI. I'll post some images on my social media today, but the MRI will show shrinking of the muscle fibers, yet the overall compartment of the quadricep or biceps or whatever remains the same, but it's infiltrated with fat. So people go, I'm not losing muscle, but not realizing that they are losing muscle and infiltrating that with fat. We know that muscle is denser than fat, so it weighs something like 3 times more than fat. So people just slowly, gradually lose muscle, infiltrate and replace it with fat, lose type 2 fibers, which are the rapidly active fibers, of course, as we age. Again, lose metabolic activity. It's a vicious cycle. So really got to rage against the ravages of time. And the only way to do that really is to maintain a bioavailable source of protein, which in my opinion is animal source protein. In fact, the science would back it. That's the most bioavailable for our gut to access. And lift heavy things just to kind of keep the muscle active. I think too many people are obsessed with cardio, and I think that's a mistake.
I agree. And if you look at those cross sections of those those thighs, for instance, with the fatty infiltrate, you'll always see an increase in osteoporosis along with it. You'll see that bone loss is significant because that fat is inflammatory, as you mentioned, it's pro-inflammatory. So we've got a pro-inflammatory situation happening, and the muscles and the bones and the joints are all BFFs, much like the liver and gallbladder and gut, right? Like what one's doing, they're all doing. And so in my opinion, I truly believe that metabolic syndrome starts in the muscles. I think that the vicious cycle of that fatty infiltrate, then we get the inflammatory induced sarcopenia, and round and round and round it goes. And those who have metabolic syndrome or diabetes have a much harder time building muscle because of that cycle. And so they're even, they've got a bit of an uphill climb there initially. But as that metabolic syndrome starts to regulate and become more to healthy levels, that muscle will start to come on more readily. That fatty infiltrate will get burned up and used, and the bones will be much happier and healthier. So people don't get it. They just take a pill for their bones, and I guess there's no really pill for the muscle except for muscle pain, but we're missing the mark. Like you said, in traditional allopathic medicine, there's just a huge hole, and the root cause is like the big elephant in the room. That's not being addressed. So,
absolutely.
Oh my gosh, I love every minute of this. I want to bring you back and talk about animals next time, okay?
Yeah, I'd love to. I'd love to, Tina. And I think we've spent the hour talking about animals, and that animal is a human being. And we should definitely try and reconnect with that concept that we are fundamentally a primate that learned to scavenge, that learned to hunt, and then learned to farm. And maybe the farming aspect had advanced. It was definitely advantageous for us to build civilization, but the compromise was our general health. So I'm not saying that we go back to being hunter-gatherers. I'm not romanticizing their lives. They've got very difficult lives and high infant mortality and whatnot. But if we can replicate some aspects of their life, I think we'd be a lot happier and healthier for it. And I think it's really important to look at life through an evolutionary lens, and we've stopped doing that.
I agree so much. You put it so elegantly. Okay, where can everyone find you? Your Instagram is fabulous. Tell them where that is, what your handle is.
Yeah, thanks, Tina. So I'm Dr._Pran Yoganathan on Instagram. I'm shadow banned, so good luck finding me.
I'll link it. I'll make sure to link it.
Thank you. Yeah. So shadow banned, I'm not sure for what. I think I'm just posting facts as far as I can see. But and I'm also on Twitter and Facebook with the same handle. So it's just a good medium to get my message out, and I try and post as regularly as possible.
Well, I do have a decent Australian following. So if anybody were interested in coming to see you, is that an option with your healthcare system?
Yeah, absolutely. So I'm in Sydney, Australia, and I tend not to do too many telehealth type appointments because it's difficult because, we need to do colonoscopies and physical examinations and so forth. So I prefer the face-to-face. But yeah, absolutely. I'll be happy to see people, especially people that are kind of motivated to make some positive changes in their life. And we've got a great infrastructure in our rooms with dietitians and exercise physiologists and, movement specialists and so forth. So yeah, more than happy to kind of help in that regard.
That's awesome. Well, it's been such a pleasure. I'm so glad to finally meet you face to face. I know it's through a computer, but what an honor to finally speak with you. And we will have you back on. We'll do a whole animal episode, okay?
Would love to do that, Tina. It'd be a pleasure to come back on. And thank you for having me on. It's a pleasure.
Thank you.